problem.
Welcome back. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. My next guest today, we're very lucky to have him here, Dr. Anthony Shaheen, board-certified urologist. Dr. Shaheen, thanks very much for joining us.
Oh, thank you for having me.
Dr. Shaheen, I know that urology is really a huge field and really misunderstood by a lot of people. What I'd like to do is start off by going over your training, how someone gets to be a urologist, and then we'll talk about, a little bit about what your typical day is like. So after high school, what do you do if you want to be a urologist?
Well, after high school, just like anyone that wants to be a physician, you have to go to medical school. First, you need 4 years of graduate school, bachelor's degree, and then 4 years of medical school.
Okay, so after the 4 years of medical school, and then you go to an internship, or do you go to residency in urology? How's that work?
Well, I did the internship in general surgery and then a residency in general surgery, so that's 2 years of training in general surgery, and then I subspecialized in urology, and that's three more years.
So when we say general surgery, really a general surgery intern or the first-year resident, you're really learning how to operate and how to take care of sick patients and how the operating room works, and you get your hands dirty and you learn to tie knots and you learn more anatomy. Isn't that right?
Exactly. We learn about taking care of critically ill patients, trauma patients, surgical techniques, and surgery on all the parts of the body.
And then you chose to go into urology. And what is urology? What's your specialty concern with, Dr. Shaheen?
Urology is mainly the genital urinary tract. We deal with the kidneys, the ureters, the tubes that drain the kidneys, the bladder, and the genital system. And we deal with cancers in all those areas. We deal with infections in those areas or other problems that can occur with the prostate or the bladder or with urinary incontinence.
So, Dr. Shaheen, let's talk about your typical week. Do you see patients in the office? Do you operate? Do you some days operate and some days see patients? Do you go to the emergency room? What's your typical week like?
For urology, it's pretty standardized. Many of our surgeries are electively scheduled, so that's the nice thing about urology. You have a nice office schedule. But the other nice thing about urology is many times we see a lot of patients in the office and we see them routinely, and whatever problem they have, we can make it better. The other thing is with surgeries, we operate pretty much every day or every other day depending on what's on the schedule for us here.
So it's the urologist that really takes care of and is concerned with the genital urinary system, as you described, beginning with the kidneys and then going on to the ureter and the bladder and the prostate and the urethra, etc. Isn't that right?
Exactly.
So I understand that within that system there can be some pretty common problems. Isn't that right?
Absolutely.
Dr. Shaheen, what I'd like to do, if we can today, is talk about prostate health. And, you know, we have to kind of get this out in the open, kind of get it out of the closet. Most people, I think, they've heard of the prostate, but they don't really know where it is, and they don't really know what it does. So if you could help us with that, let's define the prostate in terms of telling us where it is and why we have a prostate.
Now, only men have prostates.
Okay.
And the prostate is at the base of the bladder. And the main function for the prostate is for reproduction. So the fluid that occurs when a man has an ejaculation, majority of it comes from the prostate. That fluid helps with sperm motility, it helps with fertility and reproduction.
Okay. So, and roughly what size, how big is that? What's the size?
The prostate's the size of a walnut, we say about this big, so the golf ball sized gland.
Okay. So the first thing I'd like to start to talk about is prostatitis. Now, can't the prostate gland get inflamed? Now, can that happen?
Sure, and there's several things that occur with the prostate. One common problem is prostatitis. That's inflammation of the prostate. And men can have symptoms, burning with urination, frequency, urgency, pelvic pain, pain with any type of activity here. So that can be a chronic condition, and sometimes it's very difficult to clear up.
So does prostatitis mean there's an infection, Dr. Shaheen, or just a kind of inflammatory process going on?
It could be several things. It's most likely an infectious process with bacteria, and many times we'll treat patients with antibiotics, but many times it can also be an inflammatory condition, like an autoimmune disorder. Nobody knows exactly what's causing it, but something is triggering your prostate or triggering your body to react against the prostate.
Okay, so typically, how old is the patient that might get prostatitis, and how would they present? In other words, what are their symptoms?
Prostatitis can occur at any age. Usually you'll see it in younger men in their 20s, and you'll see it in men as they tend to get older. Typically this reoccurs, especially in older men with enlargement of the prostate. They can get in bladder infections and infection in the prostate.
Okay. So we've talked about the prostate and where it's located and the size and the function. We just started to talk about prostatitis. Now, maybe we could go one step further and talk about what happens when the prostate gets too enlarged. And you know, you could barely watch a sports game on television and not hear about Flomax or other medicines and frequency and things like that. So what happens when the prostate gets too large?
What happens with enlargement of the prostate, and all men get enlarged prostate sooner or later in life, it's going to happen to all of us, but the urinary tract, the urethra, goes through the center of the prostate. So as it gets enlarged, it pinches off the urethra, and that's when men can develop urinary symptoms such as nighttime frequency, getting up 3 or 4 times a night, difficulty holding the urine, there's urgency, they don't empty the bladder out as completely or feel they have to go all the time. Those are sort of your typical symptoms of enlarged prostate, or what we call BPH.
So again, now Dr. Shaheen, we try to do a public service with this program, and you said that sooner or later all men's prostate gets enlarged or larger. Isn't that true?
That's correct.
So again, for our audience, let's go over the symptoms of what an enlarged prostate might be, and how would they present?
They'll present with urgency. They can't get to the bathroom in time, or they're running all the time to the restroom. Frequency of urination, weak stream, dribbling, having to stand there a while to eliminate the bladder, and nighttime frequency. And then at that point, if things get really bad, they'll start developing blood in the urine or urinary tract infections. And that's a sign you really need to get evaluated or checked out to make sure there's no other underlying problems such as cancer.
Okay. Dr. Shaheen, now let's say somebody in our audience who's listening or viewing, let's say they have some of these symptoms. Is it a good idea to call their family doctor? Should they call the urologist? Should they go to the urgent care center? I mean, what's the typical best way to get
Usually they'll see their primary care physician to be evaluated to make sure they don't have a bladder infection. They should always get a PSA test, and that's something we can discuss later that helps check for prostate cancer. Those are the most important things, and at that point, then we usually will see those patients as a referral for either medical therapy or other surgical treatment.
Okay, now you just mentioned a couple very important phrases. That's the PSA, and we'll get to that, and prostate cancer, and we'll get to that. But before we go on to that, how do you take care of what you called BPH, or benign prostatic hypertrophy? That's when the prostate gland gets enlarged, right? So how is that treated? What do you do?
First-line therapy is medication. There's great medications such as Flomax you may have seen on TV. And those just relax the muscles in and around the prostate. So when it comes time to urinate, the prostate opens up and you flow easier. And you empty better. So that's usually the first-line therapy. There are other medications similar to Flomax that can help relax those muscles along the prostate. There's medicines to shrink the prostate, such as Proscar or even Avodart. And those are common ads you see on TV. Sometimes medications don't work for everyone. Probably only 50 to 60% of the time it's effective. And if medications don't work or patients have side effects, then we talk about surgical options for enlarged prostate. And there are many treatment options. There's a whole spectrum depending on the severity of your problem. Many times there's treatments that we perform in the office to shrink the prostate. It's microwave therapy or radiofrequency ablation. That's done in the office. It's safe and easy to do. There are other surgical procedures such as laser surgery where we can go in and open up that passageway with the laser fiber. But those are the main treatment options.
Okay, Dr. Shaheen, it sounds like, as you've said, BPH, or benign prostatic hypertrophy, is very common. And we need to emphasize to our audience that just because a man has experienced these symptoms, it doesn't at all mean that he has a prostate cancer.
Correct. There are two separate disease processes. BPH, or enlargement of the prostate, is unrelated to prostate cancer. Now, men can have both conditions at the same time, and that's why it's important to be evaluated if you start having urinary symptoms, get a PSA test, and have an examination by your physician.
Okay, so let's go on to that. So we've talked about the prostate, we've talked about inflammation, which is prostatitis, We've talked about BPH, or benign prostatic hypertrophy, when the prostate gets enlarged. Now let's talk about prostate cancer. Now, how common is prostate cancer?
Prostate cancer is very common. It's the second most commonly diagnosed cancer in men. And probably about 200,000 men will be diagnosed with prostate cancer this year.
200,000 men will be diagnosed with prostate cancer this year. That's amazing. So you mentioned PSA. What are those? What's this alphabet soup, Dr. Shaheen? What does PSA stand for?
PSA has changed prostate cancer dramatically over the last 20 years. And PSA stands for prostate-specific antigen. It's an enzyme produced only by the prostate gland. And the prostate secretes small amounts of PSA in the blood. So if the PSA level is elevated, it could mean you have prostate cancer. It's not necessarily due to prostate cancer. If you have an enlarged prostate, that can cause the PSA to be elevated. If you have prostatitis, as we discussed, inflammation of the prostate, that can cause the PSA to be elevated. Or if you have prostate cancer, that's another reason to have it elevated. Or with age, as you get older, the prostate tends to secrete more PSA. So your PSA level usually goes up gradually with age.
Okay, so people get a PSA, which is a blood test, right? They simply get some blood drawn from their arm, right? And we can send that blood to the laboratory. And they also get an exam, right, by the urologist, or if their family doctor is skilled and experienced in that, they get an exam. Now, let's talk about the treatment of prostate cancer. And I've been told that sooner or later, if you live long enough, if a man lives long enough, there's a high likelihood that he'll get a prostate cancer. Is that true? That's
true. If all men live long enough, you can get prostate cancer. And it's not so much the cancer, but we look at the patient's age, the aggressiveness of the cancer, how much cancer is there, how high the PSA level is. And there's a whole spectrum of treatment options. If you're an elderly man and you have a small focus of cancer or not very aggressive cancer, we treat them with watchful waiting, which means no treatment. We just examine them and check their PSA periodically. And as long as that PSA goes up slowly over time, we really don't have to do anything for those patients. So that's an easy option and a nice option for older men or men that have significant underlying medical conditions. We don't want to put them through the stress or risks of surgery or other treatment options.
Okay. Now, Dr. Shaheen, I want to make sure before our interview session is over today that we go over the recommendations by the American Urologic Association and probably the American Cancer Society. Now, who gets a PSA test and how old should a man be when he gets his first PSA test as a routine screen? What's the society recommend?
We recommend routine PSA screening all men over age 50. So all men over age 50 need a PSA, and they also need a digital rectal examination, because many times the PSA could be normal and there's an abnormality in the prostate, and that's only on examination. So many times men say, well, my PSA is normal, I'm okay, but you still need to do a rectal examination on them to check the prostate. If you have a family history of prostate cancer or African American, you should start at age 40.
Okay, Dr. Shaheen, I think it's important that we really need to do a public service for our audience here. So in summary, every man 50 or over needs a PSA screening test, right?
Correct.
And they need to get a digital exam, right?
Correct. And probably another important thing is they need to know their PSA number. Just like your cholesterol number, you know what that is. We need to know what your PSA number is every year, because PSA can go up gradually over time. And if it's 1 year and 2 next year, it's doubled in a year. That could be a sign of early prostate cancer. And that's probably the most important thing with the whole PSA business, is tracking that PSA over time.
Okay. And before we go on with tracking it, I want to reemphasize. So all men 50 or over get a screening test, and you said that if there's a strong family history or if you're African American heritage, you should get a screening test at age 40.
Correct.
Now that's because the incidence of prostate CA or cancer is higher with African American heritage. Correct. And it can be familial. In other words, if it's strongly in your family, then you may be at higher risk.
About 15% of prostate cancers are hereditary. So if you have a family history of prostate cancer, if you have that gene, the prostate cancer gene, there's about a 50% chance you can develop prostate cancer.
Okay. Now, Dr. Shaheen, again, we want to do a public service here, and we want to encourage everybody to get screened. But as we said, just because you get a diagnosis of prostate cancer doesn't mean your life's going to be shortened. It is not necessarily a disease that's going to shorten your life. Isn't that true?
That's true. Nowadays, the treatment of prostate cancer has changed dramatically. There's surgical treatment options, and we all do nerve-sparing surgery. We can eliminate side effects such as impotence and incontinence. Nowadays, surgery is done pretty quickly and easily in the hospital, 3 or 4 days, and patients recover pretty quickly from it. So it's pretty routine. It's not like how it used to be 20 years ago, where many patients have just heard the horror stories about surgery and complications in the past. Nowadays, it's pretty routine and done pretty easily. But there's surgery. There's various forms and very new forms of radiation therapy that are very effective for prostate cancer. You can target the tumor very accurately and minimize the risks of damaging the surrounding tissue without less side effects as impotence and incontinence also.
Okay, so again, for men who are concerned about their virility and about their sexual activity, if they need treatment for the prostate cancer, doesn't mean that their sexuality is over, or doesn't mean that they're going to be dysfunctional, etc. Isn't that true?
Absolutely. There's lots of treatment options for those patients and ways we can help them if they do have a problem with their sexuality.
Okay. So Dr. Shaheen, we have a few minutes left, and I want to make sure we give out your phone number and or your website, and then I want to talk a little bit about what else the urologist does during the day, because I'm sure we could talk about the kidneys or kidney stones, we could talk about incontinence, etc., just for hours. So before we go on, tell me if someone wants to contact you, and again, that's Dr. Anthony Shaheen, S-H-A-H-E-E-N. Now, do you have a website or a phone?
I just have a phone number. My phone number is 373-3600.
3600. And you're located here
in Monterey.
Dr. Anthony Shaheen. Okay, so I think we only have a couple more minutes left, but what else does a urologist do besides take care of the prostate?
I do a lot of things with the urinary tract, such as urinary incontinence, and that's a big part of my practice. There's treatment options for incontinence, such as new surgeries, such as sling procedures. There's done as an outpatient, and patients return to normal activity pretty quickly. We treat kidney stones. We put in pacemakers for the bladder. It just goes on and on. There's all kinds of neat things that are developing for urinary incontinence.
So, Dr. Shaheen, we have about a minute left. Let's just summarize this idea of incontinence. Now, who comes to you, and what are the symptoms of incontinence?
Incontinence can affect all people, men and women, about a third of the time in their life. Many times it's women that have this problem due to childbirth or with aging, or they've had previous pelvic surgery and the muscles in the pelvis become relaxed. That's the most common type of incontinence, what we call stress incontinence. They leak with physical activity. Many times it's teaching a patient how to do Kegels correctly, and we can teach those patients in our office. We have biofeedback that can really teach them and show the patients how to do those exercises correctly. There's great medications for urinary incontinence, and you see all the ads on TV all the time. And there's also surgery, such as I discussed, these little sling procedures to help lift the bladder. And a lot of times they're done easily as an outpatient.
Well, Dr. Shaheen, I must say, you guys are amazing, and you do a lot of great stuff. Dr. Anthony Shaheen, you take care of the prostate, you take care of kidney stones, you see patients with incontinence, etc. And once again, I just want to emphasize, you said that all men 50 or over need a PSA and a digital exam at least once a year, and that if you're African American or with a high family incidence of prostate CA, get a check of your PSA at 40.
That's absolutely correct. Thank you.
Dr. Anthony Shaheen, urologist, thanks very much for being with us.
Thanks for having me.
I'm Dr. David Morwood, and I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause. Thanks for being here.